Randima, Randima is online up already?
No, not yet. We're going live at 10:30.
Yes, here. Okay. Distinguished guests, members of the press, ladies and gentlemen, good morning. I'm Chawarat Yongjira Nonar Pupe, and I am delighted to be with you here this morning as moderator and MC. I'm a freelance reporter based in Thailand, and so it's really exciting for me because today we're going to be presenting the media briefing on UNFPA's State of World Population Report 2024. Please note that we are live actually on Facebook right now. And so we'd like to say hello. Where's the camera? Hello to people online with us. So we hope that you will also be a part with us as well with our Q&A briefing today, because we really want to engage at the important points of this report today. So we invite everyone here to ask a question or give any comments if you have any. So let me go through what we're going to be doing today. First, we'll be having the opening of this event, and we'll have a brief video to introduce the key issues to you, and then we'll have a special discussion with our guest speakers. And for that, I'm pleased to be joined with Mr. Pio Smith, the UNFPA's Regional Director for Asia and Pacific. There we have it. And also Ms. Catherine Breen Kamkong, the UNFPA's Regional Advisor for Sexual and Reproductive Health and Rights and Maternal Health. So as the United Nations Sexual and Reproductive Health Agency, UNFPA strives to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Yet, thousands of women and girls across the world today, and even in this region, are left behind. Or we're asking the question today, are they being pushed behind? Every year, UNFPA releases its flagship publication on the state of the world's population. And this year, the report delves into the inequalities and the inequities that women and girls face. The report highlights how decisions on issues such as racism, sexism, and other forms of discrimination continue to disrupt the universal access to sexual and reproductive health and rights, and what more we can do together to help address these issues. So to give you a better picture, here is a video to learn more.
Así fue como comenzamos a trabajar a una manera lenta, pero bastante positivo, bastante efectivo.
Los métodos de planificación familiar, los anticonceptivos, las enfermedades de transmisión sexual.
Bueno, la discriminación siempre ha habido.
It might intersect with our gender identity, might intersect with our ethnicity.
We had a spate of violence against people with albinism.
We were not recognized. We do not have any kind of rights.
I live in hiding because we lack legal documents. I have no insurance. If they have no insurance, no medicine die.
So we have to know where these people are and can come up with better policies.
There are simple solutions to help us be more inclusive.
With disability, taking them on board from the beginning, engage them.
Culturally relevant services for Native people.
Help ensure that people are treated with dignity and respect.
So definitely, I hope that the video has spurred some curiosity amongst us today, because if you've noticed that the artwork and also in the pamphlets that you have in front of you, the art is actually tapestry. It's not drawings. And that is the theme for this year. Humanity is a diverse tapestry. Every person, every thread makes us stronger. And with that, ladies and gentlemen, to deliver the UNFPA statement on the launch of the State of the World Population Report in Asia and the Pacific, I would like to invite the UNFPA's Regional Director of the region, Mr. P.O. Smith.
Thank you, Pepe. So, good morning, everybody, dear colleagues and friends. Thank you for being here and for this opportunity to present our State of World Population Report 2024. So, as we just saw in the video, our world is more intertwined than ever before. Yet when we read the headlines, what do we see? War, polarization, division, fear. These harsh messages are eroding faith in the one proven solution to the world's greatest challenges: cooperation. Humanity thrives on cooperation because our fates are woven together. We all share a common future. Today, I'm very pleased to present UNFPA's flagship State of World Population Report entitled Interwoven Lives, Threads of Hope, Ending Inequalities in Sexual and Reproductive Health and Rights. In it, we show inequalities and inequities are widening. Human reproduction is being politicized. The rights of women, girls, and gender diverse people are the subject of increasing pushback. And we ask you, our colleagues in the media, are the most vulnerable being left behind, or indeed are they being pushed behind? We can and we must push forward together, because that is what works. Global solidarity. That is how we reduced the unintended pregnancy rate by nearly 20% since 1990 worldwide. That is how we reduced the maternal death rate by 34% since the year 2000. And global solidarity, that is how we reduced new HIV infections by 1/3 in the last 15 years. In the last 3 decades, the proportion of women serving in parliaments across the world has more than doubled. We have secured laws against domestic violence in more than 160 countries. That progress has taken place in this region too. Across Asia and the Pacific, people are living longer. It is safer for that woman to give birth and more possible for that girl to choose her life's trajectory. With a reduction in child marriage, there has been a steady decline in adolescent pregnancy. For example, in 2000, there were 56 births per 1,000 young girls aged between 15 and 19 years old. In 2023, this figure dropped from 56 to less than 24 births, representing a 32-point decline over the last 23 years. These are gains that we've all achieved together. These are gains that, following the global agreement of our member states at the International Conference on Population and Development in Cairo 30 years ago, where governments agreed to ensure the reproductive health and rights of all people. And since then, our capacity for global and regional cooperation has only grown. New technologies allow for real-time information sharing. We have a greater ability to collect and to process data. We know much more about the world and its needs, and importantly, the solutions that are required. But as we just saw in the video, at the same time, we see progress is slowing. And while there has been an over 60% reduction in maternal mortality in Asia and the Pacific since the year 2000, the bulk of that reduction was between 2000 and 2015. Since then, this region continues to struggle with high numbers of preventable maternal deaths. Every hour, more than 6 women in our region die during pregnancy and childbirth. Less than 1 in 4 sexually active unmarried young people use contraception. On average, half the women in the Pacific Islands have been beaten, abused, or sexually violated by their intimate partner at least once in her lifetime. So the question becomes, why is this happening? One important reason our report shows is that we are not effectively reaching those furthest behind. We have seen, for example, that barriers to healthcare fell fastest for women who are more affluent, educated, and privileged. In other words, we see that the groups that have benefited the most are those that had the fewest barriers to begin with. Access to modern contraceptives, for example, varies by many factors such as ethnicity, refugee and migration status, education, and location. I saw this myself a few months ago when I visited a remote health clinic in a village in North Tarawa in Kiribati in the Pacific. I observed a nurse inject a woman with a contraceptive implant, and another lady stood over her, holding up a torch from her mobile phone. With such limited resources, anything could go wrong at any moment. But this was their reality. And in the room next door, there were line markings drawn on the cement floor. And they told me that these lines were indications of the slanting where the water would drain after the floor was washed, something they had to do often. Why? Because they deliver babies on the floor due to lack of beds. I also visited the storeroom where they didn't have a refrigerator for cold supplies. For women living in such remote areas, how is it that we can do better to make sure that they receive the care and attention they so desperately need and which they deserve? So, my dear colleagues from the media, many of the findings in the report are the result of having better data than ever before. 30 years ago, maternal mortality rates were only rough estimates. Today, data allows us to see clearly the unacceptable rates at which women are dying while giving life. Data also shows the inequalities that are quite literally killing them. For example, a 15-year-old girl in the lowest risk country has a 1 in 23,000 risk of dying from pregnancy or childbirth. In the highest risk country, that's a 1 in 34 chance of dying. 1 in 23,000 versus 1 in 34. And while there are vast inequalities and inequities between countries, our report finds that in many cases, disparities in health access are even greater within countries. Health systems are tainted by gender inequality, displacement, racial discrimination, and misinformation. For instance, in Asia and the Pacific, some 350 million women and girls live with disabilities. And those girls and women are up to 10 times more likely to experience sexual abuse. 10 times for our disabled women and girls. Women from indigenous ethnic groups are less likely to receive antenatal care, less likely to give birth under the care of a skilled birth attendant, more likely to give birth as an adolescent, and significantly more likely to die of causes related to pregnancy and childbirth. Women and children are 14 times more likely to die than men during a disaster due to various factors that stem from existing inequalities. Such inequalities are plain facts of life for millions of people across Asia and the Pacific, and indeed our world, sadly. These inequalities should not be politicized. They should not be used as an accusation of bias. They should not be points of division that push people behind. Rather, they are and should be entry points for accelerating progress. Because everywhere we look, we see gaps, and those gaps are widening. Stalling progress will turn into a reversal of progress. Anxiety over higher fertility rates, low fertility rates, global migration, that's leading to xenophobia and turning women's bodies into battlegrounds. Yet these trends, population growth in some places, population aging in others, accelerating migration, they are unlikely to change. But we know what we can change. We must redouble our efforts to achieve comprehensive, universal, and inclusive healthcare, grounded in human rights and modern science. A medical revolution is underway, with telemedicine and self-care poised to remake health systems. This future requires that we equip people, from adolescents to doctors, midwives, to policymakers, with accurate and modern sexual and reproductive health information. We need to collect more and better data, disaggregated by factors like ethnicity, disability, and more, in order to understand who is being left behind and how to reach them. We must make sure the most vulnerable are visible and that their rights are brought to the forefront. These measures are not simply about reaching people at the margins. They're about strengthening all of us, the whole human tapestry within Asia Pacific and beyond. Our report shows how investing in sexual and reproductive health benefits all of us. Comprehensive sexuality education, ending gender-based violence, promoting gender equality, and ending unmet need for contraception. These steps would contribute trillions of dollars to the global economy and unleash gains in terms of education, productivity, workforce participation, and human well-being. With Asia and the Pacific being home to over half of the world's population, this region undoubtedly holds immense potential to unleash these gains. And so we invite you, our friends from the media, to take this message forward. Help hold countries accountable for the promises they made 30 years ago, to place people's sexual and reproductive health and choices at the centre of population policies. Be a voice for the voiceless by sharing the stories of vulnerable communities through ethical and evidence-based reporting. We have made incredible progress by working together, and we must continue to advance towards a world of rights and choices by pushing forward those who have been left behind. Global solidarity is key. No exceptions, no exclusions. Thank you all very much for being here.
Thank you so much, Piero, for opening up the issue. I think it's a very big issue indeed that we continue to talk about, because let's just face the fact, if you take a look at the people in this room, the majority of us are women, and we know what it's like to be a woman, right? So I'm so excited actually to introduce the next speaker, because she has been on the ground doing this work, whether it's in Thailand, Cambodia, or Nepal, and she really cares about what's going on right now. And I'm so excited because she will tell you exactly what is happening. Please join me in welcoming the UNFPA's Regional Advisor for Sexual and Reproductive Health and Rights and Maternal Health, Ms. Catherine Breen Kam Kong.
Good morning, colleagues and dear friends from the media. It's wonderful, and all of those that are joining us also online. Thank you for being with us for the important launch today of our report, Interwoven Lives, Threads of Hope. My name is Catherine. I'm the SRHR Technical Advisor for UNFPA in the Asia Pacific Regional Office. We cover 22 countries in this region, which is very diverse, as you know. You also sit in this region. And it's my pleasure to present this really some perspectives from our region that relate to the report. Next slide, please. Sorry, we'll wait for the slides. Okay, they're there. Sorry, I was looking at myself. So Pio has already explained to you a little bit about the situation in our region, but we're home to over half the world's 8 billion population. Of the 10 countries, we have 10 countries in our region with the highest population in the world. Out of the 10 countries with the highest population in the world, 5 of them are in our region. That includes China, India, Indonesia, Pakistan, and Bangladesh. The region also covers those very small island nations, including 2 of the smallest in the world, the Marshall Islands and Tuvalu. And we also have some of the least densely populated, like countries like in Mongolia. The region has varied levels of development between upper middle income countries and some least developed countries. but inequities exist in all. The region is also the most disaster-prone in the world. And sadly, we also have some conflict-affected countries. And we know that conflict and natural disasters, they really exacerbate these inequities. Next slide, please. So we have made great progress, and Pio also talked about this in his speech this morning. Maternal mortality has declined by 61% since 2000, and that is the most significant decline in the world. Babies are increasingly being delivered by skilled birth attendants, which we know is critical for the reduction in mortality. The number of adolescents giving birth has almost halved since 2000, and that contributes to them being able to reach their full potential, and it also saves their lives. 32 out of 36 countries in the region have conducted at least some form of survey on gender-based violence, showing that they're actually interested and committed to trying to understand the scale of the problem and to trying to take some very important corrective actions. And we also find that unmet need for family planning, for modern methods of family planning, have reduced from 24% to 19%. So these are things to celebrate. However, maternal mortality decline has stalled since 2015. We made this big progress between 2000 and 2015, but now in our region we still have this terrible statistic, which you'll heard Pio say and you will hear me repeat, that we have 6 women dying in pregnancy every hour due to preventable causes. And this is an unacceptable statistic. We have less than 1 in 4 sexually active, unmarried young people who are able to access contraception. We have child marriage continuing to be prevalent in several countries, and we even have countries like in Afghanistan where we're seeing increase in those child marriages. And there's very sobering statistic, which Pio also mentioned, that on average half the women from the Pacific Islands experience physical or sexual violence by an intimate partner at least once in their lifetime. Huge inequities exist within and between countries. You can even think of us sitting here in Thailand, you know, the difference between us sitting here and sitting in a remote part, like in up on the border with Myanmar. So we have to always remember that global, regional, and even country averages, when I tell you a number or Pio tells you a number, they often mask pockets of inequity and disadvantage that are there in the countries. So despite the success that we've made and the progress that we've made, as I said, it's stalled, and millions remain far behind and hidden from view, particularly the most marginalised in our region. Across Asia Pacific, I've already mentioned this terrible statistic that we have more than 6 women dying every hour. But what I want to tell you is that many countries, they do not even count those women who die. So they don't review why they died or where were they when they died. And if we don't have that information, if deaths are not reported, they're not even a statistic worthy of a headline. They're hidden deaths, they're silent tragedies, and they're hidden from view. Some 350 million women and girls living with disabilities are often hidden behind, in their houses, not out in public. And we know that they're up to 10 times more likely to experience physical and/or sexual abuse and violence. And we still are not able to reach those women in the region. We've got 8% of women in our region who would like to have access to a modern form of contraception to plan or space their births, but they can't. The world's inability to reach the most marginalised is due to the unwillingness to confront the legacies of gender inequality, ethnic discrimination, and misinformation that underlie health systems. We must not forget the contribution of poverty and the challenges of reaching the most geographically remote populations. Conflict and disaster add to the perfect storm of pushing the most vulnerable even further behind. So now we're going to talk about some countries, and we're going to go to Afghanistan. In countries like Afghanistan, dying in pregnancy or childbirth, it's a common reality for thousands of women. I've seen this with my own eyes, and it's a very painful reality. Afghanistan has the highest maternal mortality ratio in the region, with 620 women dying for every 100,000 live births. That's over 8,000 maternal deaths in a year and over 40,000 newborn deaths. These are horrific statistics. The complete disruption of services for safe maternity care, which has happened in the recent years, means that women really are at even greater risk. Women have to gain permission from their husbands to even go to seek antenatal care or delivery, a safe delivery. They can't travel alone, they have to travel with a man. What do they do when the man is out working and she's at home in labour? The ban on women to attend school or higher education is also a current crisis, but it's a looming and impending, even deeper crisis. Because women and girls, they can't enter into these women-led professions like obstetrics, like midwifery, like nursing. If we have no health workers that are women for women, Afghan women won't be able to seek the care that they need to meet their needs and to save their lives. Remember, a woman in Afghanistan can only see a female health worker. So we already see a huge loss of health workers, and women in this most horrible situation are asking the UN, asking the world not to forget them, asking us to speak out for them. Now we go to Papua New Guinea. Papua New Guinea, a small country down there near my own country of Australia, has very sad situation with a very fragile health and broken health system. And this results in health facilities. Pio also talked about it in another country that he went to. This is some photos that I took in Papua New Guinea of a health facility that has no lights, no electricity, no water, no drugs, no health workers because the health workers aren't paid. And women in remote parts of the country like this, in Goroka, walk more than 6 hours to reach a facility like this that's not functioning. And the result is death of the mother, death of the newborn, inability to access family planning commodities to help meet her reproductive intentions, prevent unintended pregnancies, inability to manage sexually transmitted infections, HIV, or if she's experienced GBV or sexual violence, an inability to get that urgent health care that she needs. These women in rural areas are wishing for change, wishing to be noticed, wishing to be prioritised, but they are often forgotten. These are the women that are pushed and left even further behind. Let's go to the Philippines. I just came back from this place last week. Can you imagine being pregnant and having that as your reality? The future for you, the future for your child. This is in an area of the Philippines in the eastern Visayas where the typhoons took place. And I was just there last week and saw that the road to recovery is very, very long. It's not in the spotlight anymore, but the recovery is still ongoing. Poverty and increased vulnerability is a feature of post-disaster communities. And getting back on one's feet is even harder. And the risk of being forgotten once the immediate response is over is very real. When there are natural disasters, sexual and reproductive health is not always prioritised by governments. And yet pregnancy and birth, it doesn't stop for a typhoon, it doesn't stop for an earthquake or a tsunami. We have to do much more to ensure that countries are well prepared and ready to provide life-saving sexual and reproductive health services to these communities when calamity strikes. Working to prioritise these communities no matter what. So the reason we're here today is to launch our report, and the report really calls on us to do much more to reach those that are furthest behind. Countries need to identify who are those specific groups within their countries, and we have to find ways, design ways to reach those populations with sexual and reproductive health information and services. Data systems often don't disaggregate those populations well enough to understand the vulnerabilities, and therefore we can't develop those tailored approaches. For example, if we have a solution for what works in an urban slum in the city centre, that's probably not going to work for those that are rural, remote, indigenous, or nomadic herders who don't speak the dialects or the languages of the national language. Next slide, please. So finding solutions to address the inequities, it needs to be our top priority and not an afterthought. Health systems, they must ensure that service delivery platforms are accessible for all. Think about an adolescent who goes to school, finishes school at 2 o'clock, and they want to go and seek care in a health facility, seek contraceptive services, seek some counselling on perhaps an STI, but the clinic closes at 3. Think about the different needs of different people. We need different solutions for different populations. The health workforce, it needs to be deployed to even the most remote areas of countries. A clinic without a health worker is no solution. Health information systems, as I mentioned, they need to count what matters. Not counting people and not counting maternal deaths, it's not acceptable. Essential medicines must be there. They must include life-saving maternal drugs and contraceptives. These help save lives and they meet the needs and the intentions of women. And as always, the poorest have difficulty in accessing any of their rights, and sexual and reproductive health is no exception. Health systems, they need to prioritise financing schemes that are pro-poor and ensure that cost isn't a barrier to seeking care. At the heart of the solution is accountability. Accountability to all populations in need and good governance that listens and prioritises the needs of those most left behind. So the time is right now. We only have 5 years till the SDG targets need to be met. More than that, we are talking about human beings. We're talking about human lives and realising their human rights, their sexual and reproductive health and rights. Reviewing and accelerating progress is even more critical in 2024. As the UN, we're plotting this chart, plotting the course ahead to 2030 and beyond. And we really need urgent action and investments to address the slow progress and these persistent disparities. So the way forward, there's not a one-size-fits-all answer at all, but what we know is that we must try and ensure that biases are removed. Biases are removed to accommodate the specific needs of vulnerable populations, like the remote and the rural, like the young adolescents that I mentioned. Data systems, they must capture the disaggregated needs of the different vulnerable groups so we can see who they are, where they are, what they need. We need to know about maternal deaths. We need to know where they are so that we can take corrective actions. Governments are responsible for their people, and partnerships between public and private institutions to increase those investments in health are needed, and specifically not forgetting to invest in sexual and reproductive health. Finally, we mustn't forget that climate change-induced disasters and conflict substantially increase vulnerability, like the examples we had of the Philippines or Afghanistan. So, final slide, please. We stand before you here, Pio and I, with heavy responsibility as UN officials to bring the voices of those most vulnerable populations to the fore. It's actually what really motivates me and makes me continue to do this work. When we see these things, we cannot be silent. We have to speak up. And we really need you as media, as the media partners, to help shine a light on these issues together with UNFPA. We need you to keep government and stakeholders accountable to the right to sexual and reproductive health for all. So we're calling on you as the journalists and media professionals to be the voice for the voiceless, those that are pushed behind and hidden from view. Help us keep the stakeholders accountable. Use evidence-based information for reporting, and we're always there if you need us to ask for specific data points. Be our ally as we continue our work to address inequities and ensure universal access to sexual and reproductive health and rights for all. Thank you.
Okay, so I think I'm going to stay here because we're going to head on to our next section, which is our Q&A and discussion. I think it's more of a discussion, right, with Pio and Catherine. And also, I just want to give some notes here that we do have information about Thailand. So if you want to know more, we have our Thai office right there in that table. So if you want any information, you can ask. For those who are online that might want information about Thailand, of course, we'd be happy to help you. You can comment whatever on the comment section. Now, with our Q&A session, it's live stream, so if you have any questions online, please send them over, type it. We'd love to hear from you. It can be a question, it can be a comment. We'd love to listen or read your comments. For those people who are here, I encourage you to ask because, it's good that we do have facts and information, but I think the important thing also is conversation about the real truth of the matter. So hopefully we'll have very insightful, useful, and meaningful conversation that benefits everyone here in the room. All right, so with that, if you have any questions, please raise your hand at any time and a microphone will be given to you. Okay. All right, so let's start with Pio and Catherine here. I'm gonna start off with, there's a lot of information. If you look at the booklet in front of you, it's quite thick. We don't expect you to read every single detail because there's a lot. But, as we mentioned, there's a lot of highlighted issues that we want to bring to the front. And, when you take a look at the, last 30 years, we've seen enormous strides in sexual and reproductive health across the world in Asia and the Pacific. How has the progress been, Pio?
Okay, great. Firstly, great job, Catherine. Thank you for the presentation. What we have to remember is that 30 years ago, governments came together, 179 governments came together, and they agreed that women's sexual and reproductive health and rights is paramount for the success of all population policies across the globe. We shouldn't take that for granted. But linked to that was a promise. It was a promise to every single woman and girl that her sexual and reproductive health and rights was going to be protected, and that she would have access to what it is that she needs. And that's indeed, for the large part, what we have been seeing over the last 30 years. So we have 76% of the laws that are required to protect that SRHR in over 115 countries. We have a maternal mortality rate that has declined by 34%. The number of women that are using contraception has doubled. Adolescent births have fallen by a third. And 162 countries have passed laws against domestic violence. That's on the global stage. And that's progress that we want to celebrate. We also want to celebrate the progress that we see here in the Asia-Pacific region. Maternal mortality, that's declined by 61%. Think of the lives that we have saved and that are around us because of that success. It's also a region that has had a steady decline in adolescent fertility. And what that means in reality, when you talk about getting away from some of the heavy facts and figures and into the reality, that means that so many more teenage girls have been able to choose a trajectory of life that has meant that she can choose, that she has her bodily autonomy, that she has more economic benefits, that her education opportunities are exponentially growing more than if she were to have become pregnant as a teenager, based on the averages. And so we feel that this is actually a very important moment for us to come together and to celebrate that progress, to take stock of it. The Secretary General of the United Nations, he's convening all of our member states from this region and across the globe in September for the Summit of the Future, where member states are going to design the compact for what's the kind of future that we want, and let's get real about what that means then in terms of investments as governments. And I think, for Asia Pacific, which is home to over half of the world's 8 billion, it's a very important moment for us to take stock, bearing in mind that we have, two of the most populous countries in our region, China and India, but we also have the least populated in terms of the Pacific countries. But it's also the region, I would say, that is most affected by a lot of these emerging trends that we're seeing around population growth, population aging, but also the calamity of climate change and conflict, migration. And so now is a time to try and safeguard the progress that has been made, and to make sure that that progress and that promise that we heard 30 years ago, that it is sustained and upheld.
Very good news, I think, in terms of what has been made. And I think sitting here, we've probably seen it, right? That there's, as you said, there's more progress. Women are playing bigger roles in this room, in our society and community. But facts are facts. People on the ground, like Catherine, are still seeing horrible cases of HEAL as well, that are still happening. Facts are facts. That across the Asia and Pacific region, more than 6 women die every hour. So within the time that we've sat here, more than 6 women have died from preventable causes related to pregnancy and childbirth. Catherine, how is this possible?
Okay, thanks, Pupe. It's possible because we have in many countries some of these difficulties that I was mentioning when I was in my presentation. We have countries where we don't have health workers, we don't have trained midwives that are out there in these remote and rural posts that are providing this essential care. Pio talked about the torch, to put in an implant for a contraceptive. You can imagine delivering a baby, and you've got 2 hands as a single midwife, and you have your mobile as well, because you can't really see what you're doing. Some of these things are so basic, but they have such a huge impact. So we still have these very fragile health systems, and conflict and disaster, even COVID, has really impacted on these health systems. And then we still have situations of poverty and inequity. So those people that we would hope would just reach the health facility by themselves, they can't, because they can't pay, they can't afford. They're up on the top of a mountain, they're on a little island, and they can't afford to pay for the boat that's going to take them to save their life. So there are still these structural inequities and also social norms. I mentioned some of the norms in Afghanistan, for example, where a woman, even though she knows she needs to seek care now, she can't, because she has to get permission from somebody else. So we have this very varied region where we've made huge progress, but we still have some of these gaps still existing.
It's sad, but true, because we're sitting in the city of Bangkok. We have so many 5-star. I say 5-star, not hotels, but hospitals, right? We are blessed. But of course, economics come into play. As you mentioned, also there are factors in different pockets of society that you have, women who need permission to go out. They need a female physician, and also, sadly, sometimes they're just invisible, because they're just overlooked, right? So when we take a look at the theme of vulnerability, being pushed behind, that's a very powerful word, being pushed behind. What do you mean by this with our reports, Bio?
Yeah, my first message would be that, what we're talking about is not exclusive to any group of countries. Every single country in the world has homework to do, particularly when it comes to women and girls and their sexual and reproductive health and rights. All countries have disparities in terms of health access. And very often those disparities are greater within countries rather than between countries. And so what our report is showing is that depending on your status with respect to wealth, depending on your ethnicity, your gender, disability, sexual orientation, all of that can dictate your freedom of choice, but also your access to sexual and reproductive health care. And what, of course, there's a lot of statistics in this report. There's a lot around the progress piece. What we're seeing in terms of that vulnerability is that, yes, the progress worked for much of the 30 years, but what it worked was for the masses. These were mass programs for populations, and that hidden within it were actually these vulnerable groups. And those vulnerable groups who had an innate amount of more barriers against them versus others within their own country. And it is those that are being pushed behind, because in fact, we haven't been seeing them, we haven't been counting them, we haven't been investing in them. And that's why they're being pushed behind. They've been left behind, but now they're being further pushed behind. And so, this report is kind of showcasing that, we are dealing with a huge legacy here of inequality and inequity. It's not just the gender piece. It's much more than that. And, unless we are able to confront that in a responsible, mature way, as partners, government, public sector, private sector, the media, academia, community leaders, then if we don't do that, then the vulnerable risk being left behind. And as we've repeated, lives are cost. Lives are lost as a result of it. And so I think, making sure that we're focused on the most vulnerable is really important, and how we do that is also by using data, the power of data, in terms of identifying the gaps, and then that will inform the solutions and the investments required.
Okay, well, excuse me, I was so into, the topic that I almost got too much involved. I think we need to open it to the floor, because I do know that there are people online that probably might have some questions, and also people here. I think there was a question. Is there a question? Is anyone having a, yes, sir. There's a microphone, so just a minute. Oh no, for the people online. For the people online.
Sorry about that. My name is Peter. I am a former journalist. I'm a journalism educator now. Pio, you mentioned that 160 countries, actually you gave two figures, 160, 162. Is it one or the other?
162. I think
So
in my speech I said over 160.
Okay, I'm sorry, I missed that. 162 countries have laws against domestic violence. That made me curious about which countries in the region do not have such laws. And if 179 countries around the world made that promise 30 years ago, does that mean that 17 countries still haven't lived up to that promise in this aspect? Thank you.
So in terms of there is the data, and my colleagues will give you the list of the countries that don't have the laws with respect to domestic violence, and that's all publicly available. Is this working?
Yes.
That's all publicly available.
Just go a little bit closer.
That's all publicly available information. On the countries that have not signed up, yes. That means that only 179 members of the United Nations family have signed up to the Promise of Cairo and everything that represents for women and girls and other populations. But I would also point out that those who have signed up to Cairo, like I said earlier, also have their homework to do. So signing up doesn't mean that you get an immediate recognition or free pass. Signing up to Cairo actually means delivering on that promise. It means talking about these difficult issues, making the investments in the data and in the programs, but also creating that conducive environment for women and girls in your own society so that they're able to lead and to thrive and to live.
Could you give an example in the Asia Pacific region of a country that does not have a law against domestic violence and why that may be so? And would it include some of the Pacific Island countries where you suggested that the problem was endemic? Thank you.
I'm not going to necessarily pinpoint any particular country that doesn't have the law and why they do not have it. But what I would say is that all of our countries are on a journey. All of our countries are going through that process of having informed debates, that are going through process of enlightening communities as to why some of these practices are harmful, why they are not acceptable. But it's complicated. And I think the focus really is on making sure that not only do we have a law in place, which of course I would advocate every single country in the world should have that law, full stop, no problem. I will completely advocate for that. But then it's one thing to have a law, it's another thing to make sure that the law is felt by that woman or that girl. And that's the difference. That's where it actually requires real transformational change at the community level. That's where you need to work with the justice sector to make sure that you have a justice sector that is capacitated to actually not only deal with those instances of domestic violence and gender-based violence and do it in a very sensitive way that includes training our male police officers and not just having female police officers to deal with this, but also that there is a sense of justice. This is about justice as well, and making sure that that woman or girl, whoever it is, that she understands that she is entitled to full bodily autonomy, and she is entitled to full justice when it comes to any injustice that she has suffered. But it's also about health systems. Health systems also have a role to play in terms of domestic violence, as does our education system. This is why we at UNFPA advocate very strongly for comprehensive sexuality education, CSE as we call it. Now in certain locations, because we want to be sensitive to that location, we'll call it a family health, family life skills education, or it'll have different nomenclature. But the point here really is that with comprehensive sexuality education comes power, because that young girl understands the power that comes with bodily autonomy. She understands her right to say no. She understands the choice she has in terms of determining who to have sex with, when, how many children that she might want to have. She understands about her body, but not just her community leaders, her parents. So all of this, like I said, is a journey for countries. So laws are one thing, but by no means are they, that's the starting point. There's a huge journey that continues as we go further down the line. Thanks.
Thank you so much, Pio. Thank you for your questions as well. Moving on to a question from online. Thank you so much for those who are watching us online for your question. This is to Catherine. Are there particular reasons maternal mortality decline is stagnating since 2015? Catherine?
Yes, thank you. Thank you for the question to the colleague online. So, as Pio explained, the very first, the very big decline that happened was through really trying to get the majority of women to deliver in a facility with a skilled attendant. And we've done that, we've done that quite well. But now, over the last number of years, we have, I could say that maternal health, it's sort of lost priority. We had other things. We had non-communicable diseases. We've had COVID. We've had many different other sort of threats and challenges within health systems. So maternal health was not really prioritized. So over the last, since 2015, we haven't had such a steep decline because we're not making those investments. we need to continue the investments to ensure that every woman has antenatal care, at least 4 times. We haven't been doing very well on those indicators, and that antenatal care is important because it picks up high-risk pregnancies and it helps us keep the woman healthy during her pregnancy. We need to make sure that every woman has a midwife or a skilled attendant at her birth, and we still have countries and pockets of countries where we have very low skilled attendants. Timor-Leste, for example, we have some parts of the country with only 15% of women having a skilled attendant with her when she delivers, so she's at a much greater risk. We've also not been able to have very good coverage on postnatal care for all women, and this is when most women die, in the period after birth. So basically we haven't invested enough in ensuring that all women have access to those critical services, and that services are within a reasonable travel time. If it's more than 2 hours, a woman can basically die on the way. She can die of postpartum hemorrhage, bleeding. So this is a thing. And the final thing is that we fail to acknowledge that expense, can be very financially catastrophic. So if a woman is very poor and she needs to go to a health facility, but she needs to pay for the tuk-tuk or the buffalo cart or whatever, she may need to sell an animal or sell something that she owns to do that. So the choice is, I'll be fine, I'll just stay at home. So now more and more we're trying to ensure that SRH, including maternal health, is part of universal health coverage schemes. And that is something that we hadn't really focused enough on in the period between 2015 and 2020. So these are some of the reasons for the stagnations and some of the areas of focus for us as we try to accelerate our progress.
Okay, 15%, that's quite slow. Yeah, anyways, okay, so thank you for the questions online. We'd like to open to the floor as well for any more questions. Yes, please.
Hi, I'm Lekha Shankar. I write for a newspaper in India. Your report was scary. I mean, the power of data is the reason for getting all these statistics, and it's really mind-boggling, and I really don't know where anybody can start and end, although the UNFPA is trying their very best. I had 2 questions. One was a particular one about my country, India, and I wanted to know about the maternal health system, any progress both by the government and UNFPA, because being huge, we have women at the top levels, and then we have women really at the bottommost who are really suffering. The general question was more like in this region, religion plays a major part. So like in Afghanistan, it's a Muslim religion that prevents the women from going out on their own. In Philippines, it's the Catholic faith that is preventing them from practicing abortion. And this is going to eventually affect America when Trump comes back to power, when the woman doesn't have control over her body. But education is needed. From what I hear, I feel contraceptives, the education to practice birth control is something that's really important. And if religions ban you, then it becomes problematic. That's why the Philippines still have large families, which have reduced in other parts of the world. The only observation I've made from India and Thailand is the modern generation, the young people now, they don't want kids. And now I can understand why. But what about at the lower levels, at the less educated levels, So if you could just tell me something about the scenario in India and how something can be done about changing the mindset of people depending on the religion and politicians and that kind of stuff. Thank you.
Okay, all right. Okay, Pio?
Okay, great. Thank you very much for the question. And India, like many countries in the region, has made remarkable strides, I would say, in terms of reducing maternal mortality. In the last 30 years, I think they've reduced by close to 20% since 1990. And that's testament to continuous investments in women's healthcare, more pregnant women delivering in health facilities, and an increase in access to modern contraception for spacing and planning pregnancies. And I'm very proud of the strategic partnership that we have with successive governments in India. We'll be celebrating in a couple of months' time 50 years of partnership with UNFPA with India, which of course isn't just at the national level, it's also at the state level, where we've been making a lot of progress in terms of that cohort of hard-to-reach communities. But like many countries, like every country, like I already said, we still have persistent inequalities within each country, and India is no different to any other country in that respect. And I think that's where having the data is crucial. Particularly for a huge country like India, it's really important that you invest heavily in data that can help disaggregate data and therefore responses to the different needs of populations scattered throughout that country, because they are disparate and they are different. On your question with respect to and sorry, I also wanted to say, because something that we touched on earlier is the critical role of midwives, and we have a fantastic partnership with India on our, building capacity and numbers for midwifery. And of course, that's part of why we have seen progress stalling, because midwifery is, one of those sectors in the healthcare that has been sidelined by, a male-dominated health profession for too long, underinvested and undermined as well. And so we work very closely with the International Federation of Midwives to bring more power, more investments, more numbers to the School of Midwifery. On your question, thank you so much for your question on the role of faith. And I think, this speaks a little bit to our friend's earlier question as well around domestic violence and some of what I touched on there with respect to, comprehensive sexuality education. But of course, it's much more than just that. UNFPA, our model for working is to be community-based. That's how, over the last, 50-odd years, we've been able to garner so much success in terms of our program delivery, but also so much knowledge in terms of what is it that those communities need. And that accountability piece is extremely important. When you are working directly with communities, you're able to explain, to break things down in a much more culturally sensitive manner. These things take time, however. And, I think even in so-called Western or enlightened or developed countries, you still have pockets of society that don't fully appreciate what full sexual and reproductive health and rights means, and why it is that every woman and girl should have that. And that's not only secluded to the cohort of those who follow their faith. But of course, faith leaders have a very important role to play, and that's why we work, and we're very proud to work with faith leaders in terms of educating about how you save lives, ultimately, because of a lot of these interventions, but also how you empower communities. You build stronger, more resilient, more respectful youth populations. If that young boy understands about comprehensive sexuality education, he'll understand that he's supposed to respect that girl and her body, and it's her who gets to make the decision. He will stand up for his sister or his cousin whenever they're being abused. He will understand the innate human right that every single one of us has. And that comes from our faith leaders, but it also comes from our community leaders and from our educators. And so, maybe just a very quick last anecdote. I was in the Pacific a couple of months ago, and I was privileged to visit a school in one of these remote islands. And there it was a school, a Catholic school run by nuns. And they took me into a classroom to see a young male teacher teach a group of 30 boys and girls about the family life skills program that we had worked on with UNFPA and the government. And I'm sitting in that room beside the head nun. Coming from Ireland, I can tell you that was a strange experience because I grew up and, you know, the nuns and the priests weren't teaching you about that. And yet now, 30 years later, I'm sitting in this, classroom where in fact they see this community needs these educators to teach the boys and girls about the life skills that they need so that this community can actually thrive, so that we avoid teen pregnancies, so that we avoid gender-based violence, and we put proper preventative measures in place to address it. So it does work, but it takes time. You have to build trust. We'll get there.
Wow. Okay. Very, very interesting point that, you know, it's not just the girls, it's the boys as well that need to have that education. Okay, we have, unfortunately, time for one more question. I believe only, okay, all right, okay, thank you. All right. But of course, you know, for those people online or with us here on site, online, of course, you can leave your comments. Our team will get back to you. Sorry, I just want to give a note to everyone. And if you aren't able to, you know, ask your question after this, we'll gladly talk to you during lunch. Okay, yes, please.
Well, I have a very simple question. 30 years ago, at the conference, International Conference for Population and Development, I do not know whether Korea attended, and Myanmar. Do you know whether, because I asked you because I am Korean, ethnic Korean, but have been living here over half a century, and because of the population rate there is 0.6. You know, it will soon disappear, Korea from the earth. And why I ask about the Myanmar is because I have seen a video clip here in this room last month or the month before about the devastation or persecution of the Karen state for the racial minority to persecute the Christians there. And I know that the Korean Catholic community has been raising money to help the Africa, particularly Zambia, to build nurse schools to help the HIV patients. So I thought if some people would deliver this message to the Catholic Foundation, I think the Korean Catholics will be very willing to help the Karen state for those, people suffering there, mostly the ladies, the girls, I think.
Okay.
So that is what I briefly thought about.
Oh, thank you for sharing that. Yes.
So, shall I answer?
Yes.
Your first question, yes, both Korea and Myanmar were present in Cairo and signed the ICPD. And you know, I would say that with Korea we have an extremely strong partnership. They're one of our strongest supporters actually across the globe. And we're very much indebted to the Republic of Korea for the generous support of the government and its people for the work that we do, but also the leadership in terms of, the thought leadership around some of these mega trends that we're facing here in this region. You touched on, aging and fertility and all of those issues that, of course, we're very aware of, particularly with Korea and Japan and elsewhere. And so we're proud to continue that partnership. For Myanmar, it's a country that we have been present in for many decades, but of course, the humanitarian crisis has worsened since the military coup in 2021. The civilian population is living in fear, with over 3 million people displaced internally, and we have 18.5 million people, half of which are women and girls, that require urgent humanitarian needs. So that has shifted our focus in terms of our interventions in Myanmar, and together with the UN system, we're working very diligently with other partners to try and bring together solutions for those women and girls in the short term, but also to try and bring together a future for Myanmar where we have peace and we have security and economic prosperity for all. On your question with respect to the Catholic foundations and with the Korean links and the work in Africa, any partner anywhere in the world that is working on SRHR will know well UNFPA's position when it comes to advocating for a positive role for faith communities to play. We advocate that both with our faith groups, but also at the national level with governments, and we'll continue to do that. And I'm happy to look into, with my colleagues over in the Africa region, to see what more might be able to be done with respect to the particular NGO you speak about. Thank you.
Okay. All right. Unfortunately, we've come to the end of our briefing, but to close it off, just to remark again, if you want to have more information, we'll provide it for you later on. Pio, would you like to do the closing? Okay. Oh, just see there.
In case you're not tired of listening to me already. But just to say, firstly, I want to say a sincere word of appreciation to all of you for giving us your time and for being here. I also want to thank our host, FCCT, and then all my colleagues behind the scene at UNFPA who've helped put this together, as well as the report authors who do a fantastic job year in and year out in terms of making us think about that woman or that girl and the situation she's facing, and pulling attention to those issues with the global community. I do want to really stress that these are not just about statistics, and they're not just about global averages, and that UNFPA, we're working around the clock to address many of these challenges that we've spoken about. But I want to just quickly wrap by talking, if I may, directly to you as representatives of the media, to say that we need you. We need that partnership, that open dialogue, that trust, that thought leadership with the media. And we need it for a few reasons. Firstly, your influence is particularly powerful in terms of holding countries accountable. Your reporting can help uncover the gaps between commitments and actions. You can bring to light areas needing urgent attention and driving countries to fulfill their obligations. And by keeping these issues in spotlight, you help ensure that these promises don't fade into obscurity. The second way you help is that you can use the power of your voice to be the voice for the voiceless. Marginalized communities, they very often face significant barriers to accessing this sexual and reproductive health services that they deserve. Their stories need to be told, whether she's in Thailand or she's in the Pacific or she's in Afghanistan. She needs to understand that her voice is being told, her story is being lived. And through your platforms, you can bring those experiences to the forefront of public consciousness, but also policy debates. And do it with compassion. do it with authenticity, and foster greater empathy and societal change. The final word I would say is that I really encourage that in the media we have ethical and evidence-based reporting. The issues that we're discussing, as you can imagine, are extremely sensitive. They're complex. They require a careful, respectful approach. Accurate data and well-researched stories can drive informed policy discourse and public policy making. And so, you know, when you do that, we get better investments that not only improve individual lives, save lives, but they also contribute to economic and societal progress. And so, as I said in my opening speech, the strength of our global community really does lie in our ability to all come together, all the different stakeholders, to cooperate, to support one another, and the media plays a very important role in that. It's a shared journey, and by upholding accountability, giving voice to the voiceless, and practicing ethical and evidence-based journalism, you can help drive meaningful change across Asia and the Pacific, and indeed beyond. So together I encourage all of us to push forward towards a world where everyone can exercise their rights and choices freely. Thank you again for your time and for being here, and we look forward to remaining in touch with you. Thanks. Thanks, Peter.
Thank you, Pio. Thank you, Catherine. We'd like to thank everyone here as well. I know coming here on a Thursday morning can be challenging, but you know, we're here for a good cause, as you mentioned there, and also as Pio mentioned, there's just so much information to be covered, and we could have gone and on and on and on about this, but let's not forget, it's a very important issue that doesn't only affect women, but our world as well. So with that, if you want to know more information, again, for the Thai side, we have our Thai office here who are willing to give you information. And of course, during our networking lunchtime, we will be having lunch in the back here. You're more than welcome to, you know, have a conversation with any of our speakers. Please join me in thanking again our speakers, Catherine and Pio. All right, and thank you so much for today. I hope you have a great day. Thank you. Sawasdee ka. In the back. Lunch is in the back. Okay. So you're more than, and I think we'll be eating here, right, Randy? Okay. Okay.